You're watching CTOM TV. Knowledge is power. Okay, so Lena would like to know, does immunotherapy cure cancer or just prolong life?
So I guess the definition of cure is required here.
Yeah.
What's cure? Typically, people like to look at 5 to 10 year rates. Most clinical trials just look at the duration of the clinical trial and don't do a follow-up, which is a real problem.
Okay. I think the average person out there in the world, when they think cure from cancer, they mean, I have my treatment, it's gone, it's never coming back.
It's hard to tell if it's never coming back because you have to follow those people for a long period of time. You have to look at them over a 20-year period of time, and that's really hard to do.
Okay.
It's very expensive. Just keeping track of people in a clinical trial for a 2 or 3 year period of time is incredibly expensive.
I guess so. So what can somebody do to make sure that they're reducing the likelihood of recurrence then, if let's say they've been successful in their cancer care with immunotherapy?
Well, with immunotherapy, I'll just back up from that question. With immunotherapy, we have what's called durable responses. And so when patients do respond, they tend to have what's called durable responses. In other words, the drugs have only been out for a while. They haven't been out for a long time. So we don't know the 20-year survival rates yet.
Oh, that's a valid point. Some of these are 1 and 2 years old.
And on about 8 years is about
the average
the
for
oldest.
The oldest
PD-1 inhibitors.
All right. So, and there's new ones coming out all the time.
Exactly.
Okay. So we just don't have enough time following patients who have had these drugs to know for sure whether they can.
But what we do know is a durable response is relatively similar to a cure. It's just that we can't call it a cure.
Okay, because we need
20-year data.
Or in essence, that person has to pass away, in their bed at the age of 110 in order for us to say, yes, the cancer didn't come back.
Right. Now, there was a study where they did autopsies on people that died of natural causes, and they found many of them had tumors that were just never diagnosed.
Oh, well, that's interesting.
Yes.
That probably happens very often then.
I think it does. Yes.
Yeah.
More than we care to admit.
Right. Okay, so immunotherapy may cure cancer. It certainly gives a durable response.
Yes, and we have patients with durable responses. We have patients who should have been dead within 3 to 5 months, 6 months, given the natural history of their disease, and they're still alive 5-6 years later and cancer free. Because of the immunotherapy.
Well, because of the combination of your genetic testing data, the research, the treatment plan, putting all that together to target it for them.
Exactly.
And it just so happened immunotherapy was the right thing for them.
Exactly.
Yes. Yeah. Okay.
That's precision oncology, the right drug for the right person.
Thank you for watching CTOM TV. Subscribe below and stay informed.